The tissues composing the kidneys.
Cortex, medulla.
Cortex and medulla. How will you be able to know that when you are looking at the tissues of the kidney, you are actually seeing the cortex and the medulla, or the medulla? What are present in the cortex which are absent in the medulla?
Glomeruli.
The glomeruli, okay. What are the functional units of the kidneys?
Nephron.
The nephrons. What are the components of the nephrons?
Renal corpuscle, renal tubule.
Okay, so what is the more common name of the renal corpuscle? Ano? Okay, Bowman's capsule. Bowman's capsule covers
Bowman's space.
what structure?
Glomerulus.
The glomerulus. So the two components of the nephrons are the glomerulus and the tubules. So on scanning objective view, how do you call those? How do you call the pointed structures? Okay, the glomeruli. So that we are looking at what layer? The cortex. This is the appearance of the medulla. So we will not be able to appreciate any glomerulus. What are the portions of the nephron present in the medulla? The loop of Henle, what else?
Part of the proximal.
The proximal stays in the cortex. What?
Distal.
Okay, the peritubular blood vessels, which are more commonly called collectively as the vasa recta. What else? The distal portion of the collecting duct na. Kasi mayroong portion ng collecting tubule na makikita sa renal cortex. Now, on high power magnification, this is how the histology of the glomerulus will look like. It will be covered by this structure, which is lined by what type of epithelium? Simple squamous epithelium, and then this is more commonly known as the glomerular capsule or the parietal layer of the Bowman's capsule. What will compose the visceral layer? Okay, very good. Podocytes. Now, what will compose the inner portion of the glomerulus? So you have the glomerular space or the Bowman space, and then this pointed structure is actually composed of, aside from the podocytes, there are lumina, which are lined by simple squamous epithelium. How do you call these structures?
Arterial.
Mayroon silang lumen.
Arterial.
Lined by simple squamous epithelium only. Capillaries. Kasi ano bang function ng glomerulus? Filtration of blood. So, blood will enter the glomerulus through the afferent or efferent? Afferent arteriole. And then inside, the arteriole will become distributed as capillaries. So the filtration of blood will start from the wall of the capillaries to the mesangial cells to the podocytes. And then the blood vessel that will exit the glomerulus is called
Efferent.
the efferent. We will not be able to identify for sure those two mentioned blood vessels, the afferent or the efferent arteriole. Now, associated in the vascular pole of the glomerulus is that structure which is involved in the release of renin. Anong tawag diyan sa macula densa, which is a part of the proximal or the distal? The distal convoluted tubule. And then aside from the macula densa, what is associated with this structure? The cells, specific cells, which are actually responsible for the release of what hormone? Renin. How do you call those cells associated with renin release? The juxtaglomerular cells, which are a component of JJ apparatus, are component is a component of. Very good. A parent or E parent? A parent arteriole. Very good.
Problem because
Okay. So we have just characterized the histology of the glomerulus. Now let's go to the tubules. There are two major segments of the tubules which are present in the cortex. And these are the proximal and the distal. So how are we now able to identify and differentiate the two types of tubules? So kanina, mayroon na tayong na-point out associated with the vascular pole of the glomerulus, a portion of the distal segment which is specialized to form the macula densa. Now, how about for the rest of the distal and the rest of the proximal tubules? Okay, so that tubule is a distal segment of the renal tubules. And then adjacent to it is the proximal. Okay, another proximal, distal. There are two characteristics by which the two can be identified and differentiated from each other. What can you say about the size of the lumen of the distal tubules? Smaller comparing to the size of the lumen of the proximal. Now, what is the function of the proximal tubular cells? Reabsorption. And then although there are also ions which are reabsorbed in the distal tubule, however, which one will absorb more materials? The proximal. That is why another differentiating characteristic is the size of the cell. Okay? Taller and much wider. Cuboidal or columnar cells? Cuboidal. Both are lined actually by cuboidal epithelium. However, the cuboidal cells in the distal tubules are shorter and thinner as compared to the cuboidal cells lining the proximal convoluted tubules. Distal, proximal. So, mas matataas ang cells and then mas matataba in the proximal because there are more number of organelles present in the proximal tubular cells, specifically the mitochondria, to provide energy for the reabsorption of the ions from the lumen of the tubule. And then aside from that, how do you call masyadong ma-appreciate natin sa ayan, this is structures projecting from the surface of both the epithelial cells in the proximal and the distal tubules. Microvilli. What is the significance of the microvilli?
for absorption.
Okay. Identify the pointed structure. Proximal, how about that one? Distal, how about this one? This is already a portion of the collecting tubule. Okay, much smaller than the distal. And then the cuboidal cells are much shorter comparing to the distal. Para mas ma-appreciate pa ninyo ang ano. Pink ang color ng cytoplasm in both distal and proximal because of the presence of what organelles? Which will provide the ATP, mitochondria. So yan, based on the size of the epithelial cells, proximal. Yan naman, distal. Yan ang color ng cytoplasm ng collecting tubules. So less intense because konti lang, parang passageway na lang kasi ang function ng mga collecting tubules. Kaya tinatawag na collect. Ko-collect na lang sila. Wala nang active reabsorption or secretion of materials to form the urine. So daanan na lang siya ng urine. So collecting tubules, distal, and then the proximal tubule, glomerulus. And then if the pointer is in that area, okay, the Bowman space. So those are the structures which you should be able to identify for the cortex. How about in the medulla? By the way, before we proceed to the medulla, how do you call these blood vessels present in between the cortex and the medulla? Na-discuss ninyo ang renal vasculature. Very good, arcuate. So, if the blood vessel is located between the cortex and the medulla, it should be called an arcuate vessel. That vessel is thick-walled, it should be an artery, and then adjacent to it, thin-walled, a vein. Now, what are the structures which will be seen in the medulla? What portion of the tubule?
Distal.
Ano sabi mo?
Loop of
The loop of Henle. What are the two limbs of the loop of Henle? Okay. Mayroong thick segment of the loop, mayroon ding thin segment of the loop. You will be able to clearly identify and differentiate the two types because of the lining epithelium. Yan siya. Anong type of epithelium yan? How about that one? Okay, the thin segment of the loop of Henle and then the thick segment of the loop of Henle. Then, bantayan nyo yung thin segment kasi the vasa recta, which are actually composed of capillaries and arterioles, will also be lined with simple squamous epithelium. We will be able to identify that they are blood vessels because ano yung red cell na yan? The presence of a red cell. Another capillary containing a blood cell. Doon. So, thin segment, thick segment, and then the collecting duct. Okay? Kasi yung collecting tubule, nasa cortex, ang glomerulus. And then lalabas sa glomerulus, proximal tubule, which will become eventually the descending loop of Henle, and then ascending loop of Henle, and then the distal tubules will go back again to the cortex. So that ang makita sa cortex, glomerulus, proximal, and distal convoluted tubule plus the initial portions of the collecting tubules. Then the collecting tubules will aggregate with each other to form eventually the collecting ducts. The collecting ducts will be seen at the level of the medulla. So those are the structures which you should be able to identify in the medulla. Thin loop, thick loop, and collecting duct plus the blood vessels. Yan sila, mga red blood cells yan sila. Daming red blood cells. They are not anymore capillaries kasi the capillaries will usually contain only one red blood cell. Those are the arterioles already. Very tubular arterioles. Hopefully, you have already understood the counter current mechanism in the formation of urine. Na-discuss niyo yan? Natapos na kayo sa kidney discussion kanina. Yes. How about in physiology?
Okay na.
So, hopefully, you will be able to understand that mechanism para ma-understand ninyo ang process of urine formation. And hopefully, you will also be able to explain why it is called by such name.
Hindi pa, no? Lalo.
Oh, pindot doon yung naka-red light na yun. Oh.
Now,
Okay, paki-press pa daw once.